954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. And here we go. Hello, South Florida and beyond. Welcome to the How to Stay Healthy show for Friday, November 30th, 2018, the last Friday in November. We're going to wrap it up here with a talk about the upper limbs, hand, wrist, elbows, and shoulders with an orthopedic surgery expert from the Badia Hand to Shoulder Center, Dr. Alejandro Badia. Dr. Badia, welcome to the program. How are you doing this evening?
I'm doing terrific. Thank you very much.
Hey, thank you for coming on the show and taking us on this adventure of health. We have a lot of ortho surgeons on the show, but not ones that specialize. You're super specialized here in hand, wrist, and elbow and shoulder, so I'm going to get right into it. Please tell the viewers and listeners a little bit about your medical specialty, if you would.
Well, it's probably the most diverse surgical discipline there is. So people are always surprised that something like a hand surgeon exists, but actually we do all the trauma of the hand and upper limb. We do all the, say, congenital birth deformities. We treat arthritis. We treat infection, nerve compressions. It's just tumors. I mean, you have it. We treat everything of that part of your body that is completely devoted to function and getting you through the day, whether it be working or hobbies or giving somebody, a loved one, a big hug.
Well, that's great news, and like I said, again, we're so happy to have you on the program. So do you treat a certain age range of patients? Because is it adult and up, or do you even dabble a little bit into pediatrics if that's needed?
Sure. No, we do everything from issues that happen right at birth. So my first patient in private practice was a preemie baby in the Bahamas that I had to fly over to see. And just recently I operated on a 102-year-old with a wrist fracture.
Wow, that is a huge age range, and that's great to know. So, yeah, you're the super specialist for anyone with hand, wrist, elbow, and shoulder trauma, ailments, injuries, and you mentioned a couple of them. We're going to get into it, arthritis and tumors. But before we do that, if you would, tell us a little bit about your experience, education, and training and background here in South Florida.
Sure. Yeah, Dave, I came to South Florida almost a quarter century ago now, in 1995, and I grew up in the Northeast. I did my undergraduate work at Cornell University in physiology, and then I then went to Manhattan and went to NYU Medical School and stayed there and became a chief resident at Bellevue Hospital, big orthopedic, a lot of big trauma center. And then I went to Pittsburgh to do my hand and upper limb. Then I went to Germany to do further trauma, specifically trauma work. And then I came here to sunny South Florida, where I co-founded a place called the Miami Hand Center, which has since broken up a little bit, and then I created my own center in Doral, Florida. So I've really been happy to be here to be able to use both my native Spanish and English and other languages along the way.
That's great news for South Florida. Yeah, bilingual physician is definitely that is definitely something to jot down as well. And I love Doral. I'm originally from Jupiter. I play a little golf, so I love that area as well. I just love visiting that area. So it's the Badia. Here, I got it right here. Great website and great URL, Dr. Badia. It's drbadia.com. So just drbadia.com. There's a wealth of information on there for the Badia Hand to Shoulder Center. as well. Now, I know you treat a lot of different ailments. Starting with arm and forearm, what are some of the non-surgical approaches that are available for the arm and forearm? And then the second part, I guess it's a loaded question, is when is surgery needed for the arm or forearm?
Well, the important thing, of course, David, anything in medicine is to to establish a diagnosis, right? So once you have a diagnosis, then the treatment will be determined completely by that. And then we usually start with conservative options, but there are some things where that may not be an option. If you come in with a ridiculously displaced wrist fracture, obviously you need to have that fixed, right? So it's just a huge area, and the important thing I think is for people to see the right type of physician. Something that I think the public hasn't always grasped that concept. It sounds intuitive. For example, if you have an eye problem, everyone knows pretty much that you want to see an ophthalmologist. But it's amazing that when people come to see me, how they've gone to a variety of clinicians that have the same expertise in the hand that I have in the eye, basically. And I think it's important for consumers today to really educate themselves a little bit, and we try to make that easy for them.
And like I mentioned before, if anyone ever wants to take a look, it's drbadia.com. There's a ton of information there as well. It's always good to kind of look around and know the super specialists for your loved ones or family. Dr. Badia, am I correct when I say that you're an orthopedic surgeon, so obviously you can treat everything from the chin all the way down to the foot, but you mostly specialize from the thumb to the shoulder?
Right. In most surgical disciplines nowadays, there's such a wealth of knowledge, and particularly the types of procedures, the sophistication, that it would be impossible really for me to, for example, even though I've done some spine surgery, there's no way for example, I know you had a guest, Dr. Hyde. I mean, I couldn't scratch the surface of what Jonathan Hyde knows in the spine, because I have to concentrate on the upper limb, which is a huge area. And then the person who operated on my knee, for example, does, they call it sports medicine, but it really ends up being particular joints that are commonly injured, such as the knee, shoulder, and the hip. And that would be Dr. Herrera, right? So what happens is, in these disciplines, we subspecialize simply because that's the only way to really be excellent at something. And it happens in most branches in medicine nowadays. I mean, the days that a country doctor are kind of dwindling for obvious reasons.
Well, like I said, I'll say the third time, we're so glad to have you as well, and that you super specialize in upper limb, because this is great to know for South Florida. And I always say beyond, because, nowadays anyone can hear the show anywhere. And there's a lot of medical tourism going on. I mean that in a good way. Like, if you look out and see if you have an ailment or a family friend has an ailment, you always look for the best in the area. And we got one of them on the show today, Dr. Alejandro Badia. He's from Badia Hand to Shoulder Center in Doral, Florida, 305-227-HAND. Dr. Badia, thanks. I want to give a quick shout out to Dr. Hyde. Like you said, yeah, he was on the show last week.
And I hate to admit, but I've been through a few of them in the last few years, and everyone always asks, "Oh, what did you do?" That's a common question, and I say I did nothing. It's life. There are things that are traumatic, right? I played rugby in college and even in a medical school league, and yet never got hurt. And I started having knee pain a few years ago. I had 2 different arthroscopies. The first one, I was literally running 3 weeks later. And the pain came back, and we found that I had a focal area of arthritis, means that I had a defect in the cartilage, the lubricating area, and not bad enough for a knee replacement, but we did a really complex surgery that I remember doing when I was, a resident, but it's changed so much that I literally was able to go back to work about 9 days later. On crutches, of course, because I can't bear weight until the bone heals. But it's an incredible experience to be on the other side. It gives me great perspective as to be a patient and to understand what people go through when they come see me.
Well, if you would, because there's a lot of Dr. Herrera's in South Florida, if you just mention his first name as well.
Sure, Mauricio Herrera. Well, I'll tell you, not only is he excellent, but one of the things that I wanted is to be in a specialized center, because nowadays it's kind of like a symphony surgery is. The surgeon is a conductor, right? But you need all the pieces. And in our center, which is the surgery center at Doral, which is where it had the procedure, that's literally down the hall from my practice of hand surgery. And at that center, Dr. Hyde and Dr. Herrera and a number of others, usually some of the best subspecialized orthopedic surgeons practice there. I wanted it done there because the anesthesia team, in this case, was led by Shane Zamani. This is one of the best anesthesiologists I've worked at. So I never had pain after surgery. He did a block of my femoral nerve. They injected a substance called Exparil. I had just been in Dublin, Ireland the week before, and one of the users up in Boston was telling me a lot about it, and we had been just starting to dabble in it, and we used that on me, and it's amazing. We'll be doing knee replacements outpatient in the coming months. We're starting to do knee replacements, and we use this medication. So I wanted my surgery done in this center just because I know what the outcomes are.
That's great, and you're comfortable with the center as well. And this is going to go right into my next question. It'll be the last question we'll get to before a quick break, but I wanted to ask you, so much has changed in the world of healthcare. Like, we think of it, an orthopedic surgeon does the surgery in the hospital, but that's not the case as much anymore. You do your surgery at surgery centers, and I know this is something that you wanted to take a little bit of time to talk about. So tell us about the change and why the orthopedic surgeons do them at surgery centers. I guess it's called an ambulatory surgery center is maybe the term?
That's correct, yes. Well, I think it depends on the specialty. For example, when you had Dr. Hyde, a lot of the surgeries that he does needs to be in the hospital. They're either patients who are more medically frail, or they're patients that definitely require inpatient admission afterwards. And we have excellent hospitals in South Florida. So I'd love to shout out some of them, but they'll get upset. I mean, it's a competitive environment, but there's really some very good hospitals. But the truth is, for certain specialties, including mine, you really never need to do this in a hospital. Hospital has a higher infection rate. We know that. It's much higher cost. That's a big challenge in our country. So surgery centers have filled this important niche of surgeries that not necessarily, they may be just as complex, but they may be better suited for certain patients. And that's, for my specialty, I do everything in that center. So I haven't done a surgery in a hospital in 4 years.
Well, that's great news. And then these patients, they walk out same day and begin their recovery, correct? Like they're not.
Sure, Dr. Hyde does a one level lumbar fusions or disc replacements in the neck of the cervical spine. I mean, that sounds impressive to people, and it is. It's an impressive surgery, but when you have somebody who does hundreds of them, and you have a whole team of anesthesia, nursing, the surgical techs, the industry people. I mean, I want to shout out to our rep, Jeff Romero from Arthrex. That's a company that makes a particular device that was used in my knee. I wasn't even familiar with it until some months before the surgery. And all of that has to come together. And when you're at a surgery center, it's a lot more predictable because you're doing the same thing week after week. So again, like I said, it becomes almost a symphony of sorts.
Now, does home health ever come into the mix as well? Is that ever needed for upper limb?
Well, surprisingly, we've had some trouble. We wanted to get collaboration, but I think what happens is everyone is so accustomed to working with hospital patients. But yes, there are some people, if they're older, if they don't have good support at home. But for the most part, people who come to an ambulatory surgery center do have some support at home, and it's not a big component. But for example, for spine or for lower limb, like I went through, certainly, yeah, in many cases that can be helpful.
Okay, Dr. Badia, hold that thought. We're going to take our quick, only commercial break. And on the other side, I want to ask you a little bit about the Tommy John surgery, because it's always in the news with baseball in South Florida on the How to Stay Healthy show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back with Dr. Alejandro Badia, Hand to Shoulder Center. It's drbadia.com as well as the URL. So, or you can just Google Dr. Alejandro Badia. It's drbadia.com. 305-928-2250. And he's located in Doral. Dr. Badia, before the break, I talked a little bit about the Tommy John surgery. I did a little research, and I think I may have got a couple things right. Is a ligament surgery that's known as kind of the UCL surgery?
Yeah, correct. What happens is in throwing athletes, and mostly baseball players, you can see it in javelin throwers, occasionally football quarterbacks, or traumatic injuries. You basically tear, or in a pitcher's case, gradually overload the ligament on the inner aspect of your elbow, right next to your funny bone. Your funny bone is the ulnar nerve, right? Everyone has banged their elbow and feels that very uncomfortable shock to your little finger, right? Well, right in front of that, there is this ligament, and yes, that is predominantly seen in baseball players, and that would be a whole topic in and of itself. But I will tell you, that's not, I wouldn't say that's like the common thing that an elbow surgeon does, quite frankly. There's a lot of other things that I did this week alone, so it is one area, though.
Well, let's are you seeing a lot more overuse injuries? Because I was reading a little bit about focused on more of pediatric athletes. If they get pigeonholed in one sport, a lot of times there seems to be overuse injuries, and with the arm, with throwing, and I imagine tennis or golf or those sports. I mean, are you seeing more overuse injuries?
Well, yes, the athletes are being pushed a little bit younger, and part of the reason is that their growth plates, what we call the physeal growth plates, aren't mature yet. They are cartilage at first, and then they grow, and that's how your bones lengthen, and then eventually they ossify or become calcified, essentially, and then the growth stops. But in males, below 18 and females below 15, 16, that growth is still very active. And if you are overloading those joints, you can have problems. So absolutely. I caution people, though, nowadays this sort of overuse or repetitive syndrome, those terms are a little bit overused. They kind of become cliches. So you want to really define what you're talking about. But in this case, yes, certainly if it's a skeletally immature athlete, meaning they haven't stopped growing, you have to count the number of pitches they can throw. They have to have more rest days. You can't push them too hard. So absolutely, that is the case.
Are you still also seeing a lot of people for, I guess, the age-old monikers, the tennis elbow, or golfer's elbow? Do you still see a lot of that as well from tendonitis?
Oh, absolutely. But now let's be really clear. That has very little to do with those sports. In fact, I just finished writing a book chapter on epicondylitis, which is either tennis elbow or golfer's elbow. Tennis elbow is the outside, the lateral side of the elbow, and much more common, about 8 to 10 times more common, where the medial or the inner aspect of the elbow becomes inflamed, and that we call that golfer's elbow. That happens in the general population, and certainly if you're a manual laborer or a particular athlete, you're going to be aggravating it more, and you may feel the symptoms more. But I will tell you that it isn't necessarily that it causes that. And in fact, I used to see the players from the Miami Open. For years, I did sort of a 2 or 3 hour clinic for them every year, and I would see a lot more golfer's elbow in the pro tennis players than tennis elbow. So just to give you an example, so the important thing again is to always get a clear diagnosis, and let's focus on what the problem is, and not so much what the perceived cause is.
Well, we're definitely going to get to shoulder, hand, and thumb, I promise, but I did want to ask Dr. Yeah, I want to get to everything. This is so great because this is a wealth of information on upper limbs.
Well, David, if I can say, one of the things that we created in South Florida, now we're also in Georgia, we're in Michigan, is group of us developed this concept called Ortho Now. So what it is the patient who has, let's say they have back pain or shoulder pain, and they don't know where to go, and they know they might want to see somebody like me, but you might take some weeks to get an appointment, right? So we created these walk-in centers, very much like the general urgent cares. But the difference is you walk into a general urgent care, you're going to see a family practice or general physician who's doing the best they can, but they're not orthopedic specialists, you see? And if you walk into an ortho now, you don't want to walk in there with a strep throat or an eye problem, right? So what we created is these walk-in, basically orthopedic urgent care centers that you can just go in with any ache or pain or any acute injury. We've had people come in with shoulder dislocations or big cuts, lacerations that need stitches, and they just walk in. There's no need to go to the hospital emergency room for that, because it's not a broken femur or a broken hip in grandma. It's something that can be treated outpatient and with expertise. So that's something that you can that they can actually download the app. The app is Ortho Now, and that app they can actually estimate. It tells you the closest one, estimate what time you'll be there, and you can even call an Uber through the app. Amazingly,
that is great. So Ortho Now is the app, correct?
That's right.
And do you also do?
Is Ortho Now Care, orthonowcare.com. That's our website.
Okay, orthonowcare.com.
Yeah.
Do you also do, I see on your website, and I haven't seen really any doctors jumping on board on this. I know it's been talked about a lot. Do you do telemedicine as well?
Oh, yeah, I've been doing it for years, because you mentioned before medical tourism. My practice, probably mainly because I'm in Miami, it's such an international city, that about 20 to 30% of my surgical, not my patient caseload, but my surgical caseload is international. So these patients, whether they be from Barbados or Ecuador or Chile or sometimes from Asia. I had a guy come from India recently. They can actually set up a consultation through my website, and then we have a good idea of what they're going to need when they arrive. So that's and we're going to see a lot more of that, and we're instituting that at Ortho Now as well, literally in the coming weeks or months.
I believe it, because it's already on your site, and you are so ahead of the curve on this, and that's great for South Florida and beyond as well in terms of healthcare. So just go to drbadia.com. It's drbadia.com. Upper right-hand corner, you'll see request a telemedicine e-visit. Grab your stylist or whatever, whatever your mouse, click on it, and there you go. And there's telemedicine. It's been talked about, but now we're actually seeing it with Dr. Badia. So that is great.
Certainly, the public and I think the community really appreciates this show, David. Is that the public doesn't get to hear these things? Even our own local newspapers. I mean, people who are doing telemedicine are doing really innovative procedures in their area. They don't get the press. I mean, let's face it. It's a lot. Our healthcare system is very complex. A lot of economics in this. So, if it's a big hospital system or a big insurance company, I mean, they're the ones who can afford the full-page ads. If you look at the ads in the newspaper, it's mostly insurance companies, which of course are a necessary part of the healthcare system, but they're not actually providing the care, right? I mean, they're not actually doing that. And unfortunately, the people out there in the trenches don't really get to educate the public. And that's why I focused a lot on my website and at the Surgery Center at Doral website. They can also contact some of the other clinicians who are really experts in their area, whether it be of general surgery, urologic surgery, and all the orthopedic disciplines. So this is a great forum for people. Thank you.
Well, we got less than 2 minutes, believe it or not. So if anyone wants to check out this show, just go to allcountyhealthcare.com. There's a radio show link. You'll be able to see it in the next few days. Or it's on Facebook. You'll see it floating around, and you can use this as an archive. I see we have a lot of viewers on Facebook, so that's great. This is the most I've ever had on Facebook viewers, Dr. Badia, so this is fantastic. Less than 2 minutes, I guess we'll do a speed round. What's some of the more common shoulder injuries you see and treat?
Okay, well, literally every day I see rotator cuff tears. Most of them tend to be a little bit older patients. They can be sports-related. We see labral tears. And then arthritis. I'm doing our shoulder replacements are being done outpatient. So people are getting a new, titanium shoulder, a shiny new shoulder, and then able to go back to moving their arm without pain. So these are some of the common things that we see.
And hand and thumb?
Hand and thumb, hand carpal tunnel syndrome. By far, that's a nerve compression. Has nothing to do with the computer. If your readers Google my name and carpal tunnel syndrome, they're going to see it just came out nationally. I basically tried to debunk the myth of computer use and hand problems. That is a big myth, David. So that is the most common.
Well, everyone Google Dr. Badia or go to drbadia.com, drbadia.com, or call 305-227-HAND. That's 305-227-4263. Dr. Badia, thank you so much. You're always welcome back on the program.
It was a pleasure, Dan. Thanks for the opportunity to share some of our knowledge with the end user, the patients.
Thank you, and have a good night, South Florida. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy Show.